What if the medication millions of people trust to protect their heart could be silently triggering a dangerous event? That small pill you or someone you care about takes daily might be doing more than just controlling your blood pressure. In the next few minutes, we will expose the 6 critical side effects of amlodipine that often go unnoticed until it's too late. Many discussions focus on minor, inconvenient side effects. This video is different. We are not just talking about mild annoyances, we are uncovering the critical warning signs your body could be sending you right now, the ones that could signal a serious medical problem. The information provided here goes beyond the standard patient leaflet. This is for informational purposes only and is not a substitute for professional medical advice. Never alter your medication regimen without consulting your physician. Amlodipine works by relaxing and widening blood vessels. This is an effective mechanism for lowering blood pressure. However, this same process is directly responsible for the side effects we are about to analyze. The first and most frequently reported side effect of amlodipine is peripheral edema, or swelling. This manifests as puffiness in the ankles, feet, and lower legs. Clinical trial data shows this is a dose-dependent effect. At a 2.5 mg dose, the incidence is about 1.8%, but this increases dramatically to 10.8% at a 10 mg dose. Some studies have reported edema in up to 25% of patients taking the 10 mg dose. What is the mechanism? Amlodipine is highly effective at dilating arteries but has a lesser effect on veins and capillaries. This creates a pressure imbalance, causing fluid to leak from the capillaries into the surrounding tissue. Gravity then pulls this fluid to the lowest points of the body, causing visible swelling. What makes this dangerous? While often manageable, you must not ignore it. Persistent edema can be a sign of developing heart or kidney issues. It is impossible to know the cause without a medical evaluation. If the swelling is in one leg only, or is accompanied by pain and redness, it could signal a blood clot and requires immediate medical attention. What should you do? First, monitor the swelling daily. Second, elevate your legs when resting to help fluid return to circulation. The most critical step is to report it to your physician. They may adjust your dose, add a diuretic, or switch you to a different class of medication entirely. Do not simply stop taking the medication, as this can cause a dangerous spike in blood pressure. The second side effect is dizziness or lightheadedness, often occurring when standing up from a sitting or lying position. This is a direct consequence of amlodipine's primary function, lowering blood pressure. If the pressure drops too much, it can lead to hypotension. When you stand, gravity pulls blood to your legs, your body's reflex to constrict vessels and maintain blood flow to the brain is blunted by amlodipine, causing a temporary drop in blood supply to the brain. Why is this dangerous? The most immediate danger is the risk of a fall, which can be catastrophic, particularly for older adults, leading to fractures, head injuries, and loss of independence. Data from the ILHAT trial showed that amlodipine was associated with a significantly higher risk of falls within the first year of starting treatment compared to other antihypertensives. What is the plan of action? If you feel dizzy, sit or lie down immediately. To prevent this, make it a non-negotiable habit to change positions slowly. Dehydration can exacerbate hypotension, so ensure adequate fluid intake. Crucially, if dizziness is persistent, severe, or leads to fainting, contact your doctor immediately. This is a clear indicator that your dosage may be too high. The third side effect is heart palpitations, which can feel like a pounding, racing, or fluttering heartbeat. As amlodipine lowers blood pressure, the body can initiate a reflex tachycardia, where the heart beats faster to compensate for the lower pressure in the blood vessels. While this is often a temporary adjustment, for some it manifests as unsettling palpitations. What makes this dangerous? The core danger lies in the inability for a patient to distinguish between a benign palpitation and a serious arrhythmia. While amlodipine is used for heart conditions, in some individuals it can unmask or even trigger rhythm disturbances. What should you do? If you experience palpitations, track when they occur and for how long. If palpitations are accompanied by chest pain, severe dizziness, shortness of breath, or fainting, this is a medical emergency requiring immediate attention. These could be signs of worsening angina or a heart attack, a rare but documented risk. Even without these severe symptoms, you must inform your doctor. They will likely need to perform an EKG to assess your heart's electrical activity and rule out a dangerous arrhythmia. The fourth side effect is a profound sense of fatigue that can interfere with daily life. This is not simply feeling tired, it is a persistent, overwhelming lack of energy. This can occur because as blood pressure is lowered, blood flow and perfusion to muscles may decrease while your body adjusts. More critically, it can be a primary symptom of significant hypotension, where the body isn't getting the robust blood flow it needs to feel energized. The danger of ignoring this fatigue is its impact on your quality of life and the possibility that it is masking a more serious issue, such as dangerously low blood pressure or underlying heart problems. What is the protocol? Do not accept this as a normal part of aging or medication. If fatigue persists for several weeks, it must be addressed. Monitor your blood pressure at home and keep a log of your readings and energy levels. Present this data to your physician. They must rule out other causes and, if amlodipine is the cause, they may adjust the dose, the timing, or switch you to another agent. The goal of therapy is not just a number, but a healthy, energetic life. Number 5 is nausea and abdominal pain. While less common, these gastrointestinal symptoms can be distressing and, in very rare instances, signal a more severe underlying problem. What is the potential danger? In very rare cases, severe abdominal pain that radiates to the back could be a sign of pancreatitis, a serious inflammation of the pancreas that has been documented in case reports related to amlodipine overdose. Nausea accompanied by yellowing of the skin or eyes, jaundice, could indicate a rare but severe liver problem. Amlodipine is processed by the liver, and while extremely uncommon, drug-induced liver injury has been reported. What is the plan of action? For mild nausea, taking the pill with food may be sufficient. However, if you experience severe, unrelenting abdominal pain, or any signs of jaundice like yellow skin or dark urine, this is a medical emergency that requires immediate evaluation. While these severe reactions are rare, awareness is critical. The final side effect is flushing, a sudden warmth and redness of the face and chest caused by the widening of blood vessels in the skin. While often harmless, it is critical not to ignore it because it can be the first manifestation of a serious allergic reaction. What makes this dangerous is misinterpreting the early signs of a life-threatening reaction. A true allergic reaction goes beyond simple flushing. Look for accompanying symptoms like an itchy rash, hives, or swelling of the lips, face, or hands. This is known as angioedema. A life-threatening emergency that requires an immediate 911 call is when there is swelling of the mouth, tongue, or throat, which can obstruct the airway. Additionally, in very rare instances, a rash can progress to blistering and peeling, a sign of Stevens-Johnson syndrome, a potentially fatal skin reaction that has been associated with amlodipine in case reports. If you experience mild flushing, mention it to your doctor. If it is accompanied by any rash or swelling, call your doctor immediately. If you have trouble breathing or swallowing, seek emergency medical help without delay. To recap, swelling, dizziness, palpitations, fatigue, nausea, and flushing are known side effects. While often mild, they can also be indicators of serious medical issues. Vigilance and open communication with your physician are your primary defense. I must stress this point: do not suddenly stop taking amlodipine on your own. Abruptly stopping the medication can lead to rebound hypertension, significantly increasing your risk of heart attack or stroke. Any change in your treatment must be a decision made in partnership with your healthcare provider. The objective is not to cause fear, but to empower you. Amlodipine is an effective medication that helps millions, but knowing the risks is essential to using it safely. Thank you for watching. If you found this information valuable, subscribe for more evidence-based health analysis.